Good morning, everyone. Dr. Christine Smith here. I have a super cool guest for you today, Dr. Amelia Barrett, who is a Stanford MD neurologist. So I'm just going to go ahead and invite her on now. But we wanted to talk a little bit about and how this contributes to other symptoms in your life, everything from headaches to fatigue overall. Hi, Dr. Barrett. How are you?
Oh, I'm good. How are you?
I'm good, thank you. So I was just kind of introducing you and telling everyone that we were going to talk a little bit about adrenal fatigue today, because I think a lot of the times people have heard of it, but maybe don't fully understand it. Or there's, those things floating around that say, adrenal fatigue isn't real, but I kind of want to teach people to think of it on a spectrum and that it's more of a system in your body that we are maintaining among other systems in the body that we are maintaining. So why don't you take a second, kind of introduce yourself a little bit, and we'll go from there.
Sure, sounds good. Hi, everybody. I am Dr. Barrett. I'm a neurologist with a specialty in headaches, and I use functional medicine and biohacking tools to show people how to relieve their pain. And I think adrenal fatigue is one of the most commonly misunderstood causes of headaches, especially in the conventional medicine community. And I think the most important things to treat. It is honestly one of the top 3 things I see that's under the surface when we pick up the hood and try to figure out what's actually causing headaches.
Absolutely. And I see it all the time in my practice too. So, the thing where people say like adrenal fatigue isn't possible. Okay, let's just talk about the physiology for a minute and like what it is that we're actually talking about. So I kind of like to teach people, I like to give metaphors and similes, right? So if you think of your body like a car, let's think of it like an electric car. Like your body's pretty much supposed to run like an electric car. It's supposed to run on battery power most of the time. And then we have gas for backup when we need. It's kind of what your body's supposed to do. We're supposed to use mitochondria, which is cellular energy health, and that's kind of akin to the battery, and that should be going all the time. And that's about 90% of what's supposed to be produced for energy in your body is from the mitochondria. And then the rest of it can come from adrenals when we need. And your adrenals are basically this messaging system. So your nervous system will activate them. They'll send out another chemical messenger, things like cortisol, which I'm sure you all have heard of. And this is why if you're stressed a lot and you're producing cortisol a lot, it can make your adrenals tired. So let's just call it tired adrenals, right? Your adrenals can get tired. And so I teach people, like, if your mitochondria aren't working well, and like say you're not breathing enough oxygen, right? That's a really good way to stress out your mitochondria, is not breathing enough or just only taking shallow breaths. Then your body has to kind of put its foot on the gas, which would be your adrenals. And if you keep putting your foot on the gas all the time, which is also done with things like coffee, because caffeine presses the foot down on the gas of the adrenals, then you start to run out of gas in the tank. And we have to allow the body rest and relaxation to refill the gas. And so if we don't do that and you drink a bunch of coffee while you're also stressed out and you're like not eating a balanced meal, because your adrenals also make up for when your blood sugar is out of balance. If your blood sugar goes down because you haven't eaten, your adrenals send out a signal that allows your liver to release backup stores of sugar for energy. But if we're doing this all the time, it's like slamming your foot on an empty tank of gas, and we just start to really wear them down. So that's the idea of like adrenal fatigue or tired adrenals, is just pushing them too hard, too fast, too long. I'll let you throw in your 2 cents on that too.
Yeah, I think that makes a lot of sense. And a lot of the confusion about this in the conventional medicine world has come from, honestly, not a deep enough understanding of the changes that happen in the body with adrenal fatigue. So just for example, there are numerous studies looking at cortisol levels in people with migraine. Well, they can be super high if you're under stress, but if you're in stages of adrenal fatigue and your adrenals are wearing out, like what you were saying, they're going to be low. So they do all these studies saying, oh, there's no connection between migraine and cortisol levels. Well, you have to understand that somebody who's here is in a very different body than somebody who's here. And that is a lot of the reason that you find so much conflicting information. If you Google adrenal fatigue, for example, and, medical websites are going to say, well, gosh, we don't know about that. But that's because of the way that this research was done. Of course, over time, we have come to have a more full understanding of what's going on in adrenal fatigue. And we understand that other systems in the body are impacted as well, like our DHEA levels, which we can talk about later. And so when we look at the whole picture, then we see a clear connection between what we call adrenal fatigue and things like headache. But the truth is that a lot of those studies just haven't been done because that level of detail was not included in the studies. So I think that, from an intuitive sense, everybody with headaches knows that there's a connection between stress and headaches, for sure. So it's not really a new concept.
Mhm.
Once stress goes on for a long time, you start to feel worse and worse. Like, we all know that. I think it's just a situation where the data hasn't caught up yet to really explain what's happening in our bodies. I think that's really all it is. But the concept, we can all resonate with that on just an intuitive level.
Yep, absolutely. And I have people asking questions like, what are the symptoms? How do we fix it? So we're going to be talking about this stuff, but we also we kind of talk about it in a way where it builds on itself. So if you can't stay for the whole thing, this will be recorded. You can always check back in. But essentially, I think you brought up a really important point of like, just because the study was done doesn't mean it was done right.
Mm-hmm.
And there's a lot of that, and I'll, on my channel and stuff, I'll have people being like, well, where's the study for this? And how's this? And this is theory. And I'm like, okay, well, yes, it's okay. Sure, you can call it theory if you want to, but it applies.
Yeah.
So just because we haven't exactly figured out the specific data points that go with it, because designing a study to really, really address every single possible variable is tough, doesn't mean that the theory doesn't still apply to how our physiology works. So when we're talking about this, like someone asked, what are the symptoms? So they'd be like autoimmune conditions, chronic fatigue, decreased libido, moodiness, irritability, depression, brain fog, hair loss, hormone imbalance, skin ailments, sleep disturbances, insulin resistance. A lot of the same issues as inflammation, right? Because inflammation and adrenals aren't really separate. Cortisol is a huge part of your inflammatory pathway. So if you are stressed out all the time, or you're eating foods that are irritating to your system and you are causing an inflammatory response, your body asks your adrenals to release cortisol, because cortisol is kind of the monitor of that inflammatory response. So when we talk about stress, it's not just mental stress, right? It's also physical stress. It's environmental stress, like toxic stress. It is nutritional stress, either, eating foods that are inflammatory for you. And sometimes you don't even know that they're inflammatory, right? Like maybe you have an underlying dairy sensitivity that isn't that big of a deal, so you never really noticed it, but it is there. And then sometimes it gets worse when you get stressed out or if you get injured. And an injury is another one that can contribute to all this. So all of these are considered stressors, and all of these are things that push your adrenals, which is why if you're really stressed out in your life and you got an injury, it may not be the best time to be more liberal with your diet. It may mean that you need to be a little bit tighter with your diet to be a little bit more careful, because if you are like prone to headaches or something, those are the moments and the times where you're going to be more susceptible to them. And so I think that's a lot of what Dr. Barrett and I teach our clients, is kind of how to really manage things by learning how to listen to your body and understand that it has a capacity. But I know, like, someone asked specifically, like, how do you fix it around headaches? And is there a link between perimenopause and adrenal fatigue? And can you get perimenopause earlier because of adrenal fatigue? Let's dive right into that DHEA thing you were talking about.
Okay, sure. So DHEA is essentially a precursor to your cortisol. So if your body is using up all the DHEA to make tons and tons of cortisol to power through your day, to get dinner on the table, to get the kids to soccer, staying up late finishing your work report, then you're going to deplete your precursor, because your body needs that. Like, cortisol has first dibs on the chemical. When there's not enough of this DHEA left over, your body can't make your hormones right.
Yep.
So this is a huge unrecognized cause of menstrual headaches, and also headaches around the time of menopause, because you become very susceptible to that drop off in estrogen. It's like you're living right at the threshold with your estrogen levels. A little bit goes down, boop, you're going into headaches. As opposed to living up here with your estrogen levels, if it goes down a little around your cycle or menopause, not a big deal. But if you're barely making enough anyway, it's going to tip you over the edge.
Yep. And
Yeah.
it applies to men too, because DHEA is a part of the testosterone pathway too, which men and women have. So, like, this applies to all of us.
Yeah, really good point. Really good point. And I just wanted to touch back on that question about symptoms for
Yeah.
people with headaches. So it's sort of interesting, actually, in the early stages of stress, the cortisol levels are high, and that can actually suppress headaches. So a lot of people who are in the earlier stages of adrenal fatigue, they don't actually know because they're powering through. Their body's making lots of cortisol. They feel okay. They're maybe only getting one or two headaches a week. But what's happening is that the cortisol is actually just like the prednisone that you get when you go to the doctor. So has anybody ever had that experience? Like you go in, you get a course of prednisone to break the cycle. That is doing the same thing as what cortisol does in your body. So oftentimes in that, short-term acute phase, people will actually feel pretty good and they're kind of wired all the time, and powering through that sort of thing, not realizing what's going on under the surface in their body, but they feel like they're kind of managing it all. And then the next thing that happens is the body does start to slow down on the cortisol, partly because of what we call an HPA axis dysfunction. And your brain starts to say, okay, I'm used to this now. I don't need to make all this cortisol all the time. And then the cortisol levels drop. This is where people start getting headaches. So when they've been powering through, not realizing it, after a certain period of time, maybe 6 months, maybe a year, they will start to get into those lower stages. Their DHEA stores are starting to really drop. They can usually still make cortisol at that point, but they're not making as much and it's not suppressing their headaches anymore. This is when they come and see me. Uh,
Totally.
yeah. And then
And I saw, or go ahead.
I was just going to say, and people are feeling tired and wired in that stage. Like they're wired still, but they're starting to get tired. They can't sleep at night. So, what were you going to say?
Yeah, so a couple things. So I saw a couple questions about, okay, so we just take DHEA, like that's the fix. Can I get that in my diet? No, I want to be careful here and say, like, one, this is not medical advice, this is educational. And two, if you are considering anything like DHEA, you need to speak with your medical provider because that is a hormone and it can really affect the rest of your hormone pathways. Someone else also asked about DHA, which is different than DHEA. DHA is actually a fatty acid, and that has to do with brain health as well. So those things can be helpful, but it's best to speak with your practitioner and figure out where the imbalance is in the first place. Because if your DHEA is off, I don't really consider it a fix to like just supplement with DHEA. I want to figure out why it's off. Like you should be able to do that on your own in a natural way. And so usually it means there's other inflammation going on in the body that is affecting your secondary cellular messaging system. And that's the way I kind of train people to think around hormone stuff is it's like, yes, hormones can be off, but it's usually because of something else. So I would rather figure out why they're off than only go and like twiddle with the messaging system. So that is my answer to that component. And then you were saying wired and tired. And I think that is so important. And I think people don't always understand the importance of it because, especially in our society, we are so pushed all the time to be going like 800 miles an hour. And during the Industrial Revolution, it got normalized to have a 9 to 5 work day. And these days, it's like you're almost given a hard time if you don't do more than 9 to 5. And that's just not like totally healthy for our systems. And so I just want to bring this awareness to people where you're like, oh, maybe I do go 100 miles an hour. And maybe when I am sitting still and I'm not doing anything, I get a lot of anxiety. And that can mean that you're actually kind of stuck in this little bit of like a wired state. And, not to say that it's not good to want to be doing things all the time, but if like being still gives you anxiety, it might mean that your chemistry is in a state where it's kind of pushing you down a road where it's leading you towards your adrenals working too hard. I'll just put it that way. Because if you're getting anxious being still, your adrenals are working in that moment. And they work to maintain your blood pressure. And they also produce sex hormones like we're talking about. So they do a lot of stuff. And, there's really general ways to support them, like making sure you get enough vitamin C and making sure you're drinking enough water and making sure that you're keeping your blood sugar level. So like I'm a big fan of intermittent fasting and stuff, but like still you need to keep your blood sugar kind of level throughout the day and not have huge spikes. And this is why, not eating a bunch of sugar right before bed or, things like that. Or if you're a female and you're on your cycle and you're stressed out and it's just been like a hard month, it may not be the month to intermittent fast and skip breakfast. You might need more support than that because you're in a phase where you're building your hormones. And that's another thing to consider for females, right? Is like, where are you in your cycle? If you're in a phase where you're building hormones, it may not be the time where you want to fast. You may want to support your adrenals by eating more regularly, things like that. And people are asking like, well, how do we check for that? And I think that'll lead us right into our next thing of like, how do we do testing? And I'm just reading this other question. Yeah, so, people feeling stressed like the wired and tired, the reason that that's important is because if we get stuck in the state of being wired, it's technically a cellular danger response. It's your body responding like there's a tiger right next to you. And if you do that for like 5 years, your systems aren't going to work right. Mm-hmm. And the neurology that runs things that you do when you're not being chased by a tiger, like eating and reproducing and going to the bathroom and regulating your immune system, like your body doesn't care about that when you're running from the tiger. So if your body's not caring about it for years on end, those systems are going to start to not work as well. And so this is why keeping track of these things and like starting to bring awareness to the fact that you might be a little wired so that we can catch it before you get wired and tired, which is like the next stage of adrenal fatigue. That's how we kind of stop this from cascading down a whole pathway. And I know Dr. Barrett wanted to talk a little bit about some of the testing she likes to do, so I'll let you touch on that.
Yeah. And so in terms of testing, I think that a good place to start is cortisol and DHEA. And these are covered by LabCorp, they're covered by Quest, they're covered by most insurances. So this is something you ask your doctor for. Caveat, they may not be familiar with this testing, so they may say, no, I don't know what to do with the results because this is not, a part of what we learn in med school. But many, many people are now embracing functional medicine, integrative medicine. So there are plenty of people out there who know, certainly functional medicine people, chiropractors, and people like you who are trained in functional medicine. They obviously know what to do. So you have to choose your person. But I think those are a good place to start. You can certainly do more tests after that. But what you'll see is that in the beginning, the cortisol level's high when you're wired, and then the DHEA level's fine. When you're in the tired and wired, the DHEA level starts to drop, right? Because you're using up all of your precursor. And then the last stage is just flat out tired. And many of the people I work with are here. They're having headaches every single day. Their brain is in what we call chronification, which is a pattern of adaptation to chronic headaches. And it makes you primed to have even more headaches and medications stop working. So if any of you are having that experience of medication stopping working, you may be in the more just tired phase of adrenal fatigue. And we see that both are low when we get to that point. And so this actually happened to me a couple of years ago, mom of 3, running a medical practice, like
you're not busy at all.
Sense of what, so you were talking about sitting still, and I was like, oh, that's me.
Oh, it was me too. This is why I do meditation and mindfulness, is to keep my adrenals in check, honestly.
Yeah, exactly. And that's really the cure. I just wanted to echo your point about that too. Like, you can't just take DHA and say, okay, pop a pill, I'm better now. You really have to get at the underlying cause and learn techniques to shift your body out of this chronic fight or flight and into recovery mode or parasympathetic mode. That's what the fix is. That's the fix. It's doable. I mean, over the years, I've certainly seen my levels start to normalize, and those of all the patients I work with too. It's doable, it's learnable, but it's not a magic wand, and it's not as easy as taking a pill. There's work. It's learning. It's changing your life. It's learning new skills. It's up-leveling your skill set to deal with what life has handed you.
Yep, absolutely. And, I like to teach people a lot about all the things that they can do at home, and because I think so many people can resolve a lot of the things that they need to. It's just like cleaning up their diet and starting to throw some mindfulness into their regular routine and drinking enough water and sleeping and things like that. But sometimes you need a little bit of extra help. And, when it comes to medications and stuff, like, they totally have their place, but I really encourage people I really am determined to break through the paradigm that of the one pill for one ill thing. Like, it's just not correct. It's just not Correct. And so if we can start training people to realize that it's more about like allostatic load and the overall stress load that your body has on it at the time, and then like that's really where things come from, because that's why people get so confused. They're like, yeah, no, I was fine. And then all of a sudden I like had a car crash and then I've just never been the same since then. And it's because like your body got thrown into this weird stress cascade that just never quite got regulated. And then it kind of went into whatever disease process you're dealing with. And so, kind of going back to the statement I said earlier, like if you're really stressed out and you're at a time where your body needs more nutrition, it may not be the time to do fasting. And that's part of that, like considering the allostatic load thing. And I want you guys to know that I'm seeing all your questions come in. So, parasympathetic. So, everyone's heard of like fight or flight, right? For the most part, fight or flight. So if you think about when you're dealing with an enemy, you try to fight it, and then when you can't fight it, you run away from it. And then when you can't run away from it, you go into what's called freeze, which is where you basically like completely dissociate from your body so that you don't feel the pain of your death as the tiger eats you, right? This is an evolutionary response. And so, but now we're dealing with it in the form of like bills and school and other people that you care about, where you can't control what's going on in their life, but you're worried about them, just things that you don't have control over, right? And that is part of what can get us stuck in a stress state for a long time. And I saw somebody ask like, well, can adrenal fatigue affect emotions? Heck yeah, it can. I will also say emotions can affect adrenal fatigue. It's kind of like a both ways thing, right? But if you have adrenal fatigue to the point where your DHEA and your building block for your hormones is low, like we've been talking about, that means that your hormones are different and your cellular messaging system is different, which means that it's going to make the way your brain functions feel different, and therefore it can affect your emotional output. And it will also affect your resiliency. And then as your resiliency gets affected, you become more emotional and more stressed out and more anxious. That then goes and affects your adrenals. And it's this like horrible vicious cycle you can get stuck in. And that's a lot of the reason that meditation and mindfulness and the things that we're talking about can help break the cycle. Because if you can break the mental stress, that's a huge load that is taken out of that allostatic overall load component of your body. And then depending on how you learn how to work with meditation, you can actually kind of start to like go in and reprogram your biochemistry, which is pretty cool. But in addition, like I like to make sure people's, diet is supported and that their gut is supported and they're not dealing with leaky gut, because that can be a whole other component. Because when your stress gets pushed, your adrenals get pushed, but your tissues essentially become more permeable so that your immune system can react. And that can also mean your gut. And so if you're really mentally stressed out for a while and then you're eating a bunch of inflammatory foods and your gut just doesn't have the same integrity as normal, then you can start to develop food sensitivities, and you have this underlying low level of inflammation, and this perpetuates over a few years. And then you're like, yeah, the last year I've just had all these migraines and I don't understand why.
Yep.
But anyway, that was my soapbox. So I'll let you throw your thoughts in there too.
Yeah, absolutely. And then, people end up in my office asking for a brain MRI saying, I want to understand what's going on with these headaches. And, that's fine. But brain tumors are like less than a fraction of a percent of headaches. And, adrenal fatigue is probably 2/3 of people I see in my office because I do this testing. And it is so, so common. Just wanted to second what you said about leaky gut too. I think that's another one of the top 3 causes of migraines that are going on. And contributing to the chronic picture. And really important to know for people who want to actually get to the root cause of their migraines, not just take a Band-Aid. I mean, those pills have their place for sure, but it's not healing. Don't ever fool yourself that just because you're taking a pill every day, your migraines are gone. They're not gone. Whatever it was that caused them is still there. And, and the problem is still there. Just because you're not feeling it doesn't mean you're...
My favorite way of looking at that is like, yes, I don't want you to be in pain, right? So like if you need something to help you, I honor that. But if you just pretend like that's the solution, it's kind of like putting duct tape over your check engine light. Like, your engine's gonna blow up at some point. So like we still need to check the engine. So that's kind of how I like to look at it. And and I've seen other people ask about like, what about thyroid stuff? What about energy? What about like fatty acid ratio? Can that be related to memory? Yeah, absolutely. Like fatty acids are incredibly important for your brain. So it's like there's many things to consider. And yes, this is being recorded if someone wants to replay. But what we're essentially saying is just consider these a red flag, right? If you start to have these symptoms, consider it a time to go work with a practitioner so that you can prevent yourself from heading down a less than great road for the next few decades. And like migraines are a great place to start. Like if you're having migraines, I mean, even in my practice, I'm a chiropractor, right? I physically work on people all the time. Like I can't tell you how many people I see for migraines and headaches, and physical adjustments totally help. But I also can't tell you how many people I have seen completely clear their migraines by having them like remove gluten from their life. So it's not always a physical thing. It can be a biochemical thing, and it can mean that you might need a little bit of extra support. And I know you had talked about like biohacking tricks that you like and ways that you can kind of use different tools in your life to track your own chemistry. So what's your favorite?
Well, I'll just show you one I have on right now, which is an Aura.
Oh, yeah,
And
those
I
are cool.
out there are using them to track their health and their fitness. But it's actually an amazing way to track a couple of parameters that are really important for adrenal fatigue. So for example, it'll give you an overnight heart rate variability, an average number. So heart rate variability is a measure of where your nervous system is at. Are you over here in fight or flight, or are you over here in recovery mode? The higher the HRV, the better, the more you are into recovery. And for me, it has been fascinating to really track what things give me a higher heart rate variability versus a lower heart rate variability. I'm such a geek. I spent last night, like I made this whole Google sheet tracking all of my Aura numbers for the past 3 months, trying to figure out what impacts my more than anything
Cool.
else. Yeah, I hate to say it, but alcohol does not relax you. It just does not. That is such a misconception. A lot of people think, oh, I'm stressed, I'll have a drink, it'll calm me down. And that is so reinforced by this data showing that, low amounts of red wine consumption reduce the risk of heart attack. And so people, think, oh, I'll have a drink, it'll relax me, it'll treat my adrenal fatigue. You guys, it doesn't.
No. And if you're trying to heal leaky gut, good luck doing that with alcohol. It just will not happen if you're drinking alcohol because it depletes your B6 and you need B6 to heal. So sorry.
Yeah. Yeah. So, I mean, I think it's once you see those patterns in yourself, it's so much more powerful of a motivator to fix them. Like somebody telling you drink less alcohol, it will help fix your adrenal fatigue. That's one thing. But when you see your numbers and you are after even one drink at night, oh, it's incredibly motivating. Yeah, so that's what I mean. And there are several other things we use. I teach people how to do this in my online courses. And so we've got a couple other devices we use. I don't want to take up all our time talking about that, but just saying there's all this new science and technology that is coming out, enabling us to really get information about our body and what our body's doing. And we can use that to heal.
Yes,
Yeah.
absolutely. And I think the whole like seeing your own data thing, I mean, there's a lot of times in clinic when I can usually figure out what's going on logically with somebody from their history and old labs, but it's never bad to have a brand new lab, and some people just need to see the data. And when they see it, then they're open to making all the shifts, and it makes it a lot easier. But like even myself, like I run online course, like a recorded version, and then like a group course, and I take people through for 5 weeks. It's like this 5-week transformational thing that we do where I take you through and I teach you how to listen to the really subtle signals of your body. Like if you wake up in the morning and you have really puffy eyelids, or like all of a sudden you have like this hood on your eyelid that you don't normally have, you're inflamed. You had some kind of inflammatory reaction. Like review what you ate in the last 48 hours. And that's like one thing among many that we can start helping people track. And yeah, you don't really have a response to that. You don't have a headache from that. Like you just have a droopy eyelid, right? Like who cares? I care because it means that you had an inflammatory response, and it means that it's part of your allostatic load, right? And if it's enough that it's like showing up in your skin, that means that your body is starting to hit a point where it's like reaching a little bit of a threshold of some sort and the fluid is building up. So just teaching people how to track themselves, whether that's through like technology and data, or whether that's through just looking in the mirror a little bit more closely, and not critically, but closely, right? Like we don't need to look in the mirror and judge ourselves, because that's mental stress. So that's stuff that we work on with mindfulness, is learning how to love and accept ourselves. But looking in the mirror and being like, oh wow, body, like I didn't realize I ate something that upset you. I need to review what I ate, and then I need to drink some water today, and then we're going to rest tonight. That's what I want you to look in the mirror and be doing, not like critiquing yourself, but just being like, where can I love myself more? Like I was kind of hard on my body today. And that's the key to health. And I feel silly saying it all the time because it seems so simple and so obvious, but I think our society has just been, trying to pick my wording well here, but has had the wool pulled over our eyes a little bit in the realm of like what health actually is. And health is this system that we maintain over time. It's not a destination. It's just like this thing that we keep track of, much like maintaining your car. Like I think people maintain their cars and change their oils way more often than they check their blood work. And it should at least be the same amount. Like you should at least take care of yourself as well as you take care of your car.
That's funny.
It's true.
I totally
It blows my mind. But I don't know. Any other things that you think are really important for people to know, or that especially come up around like headaches and things like that?
Well, I do want to offer one tool for people. As I was saying, adrenal fatigue is one of the things that leads to headache chronification. So I just want to talk about that more for just a second.
Yeah, let's do that. I think people need to understand that better.
Really, really important because it starts happening so much sooner than people realize. Literally, like I was saying, people are just having 2 headache days a week. They're in that high cortisol state. They're probably actually having more, but the cortisol is masking it. You know, they're taking pills, they're powering through, they're ignoring it. They're saying, yeah, I got this under control. But what people don't realize is that when the brain starts firing differently, it starts wiring differently. Okay. And over time, that leads to certain parts of the brain getting bigger or smaller. You can see this on super detailed MRI scans of the brain. And one of the things that happens to people with chronic headaches is that a part of the brain called the amygdala gets bigger. So amygdala processes fear, anger. Okay, that part of the brain starts getting bigger. This is not what we want when life is already throwing stuff at us anyway. And you can literally measure it on these new super cool high field Tesla MRI machines that we've got. There are a variety of other changes as well. And this whole process of change in the brain is called chronification. And this is a concept that neurologists have been tossing around for like 10 years, but people don't talk about it, and people need to know because it starts happening so much sooner than people realize. People usually don't start to take their headache seriously until they're in bed all day with a headache and their medications aren't working, until they're having headaches every single day, until the pain is just so severe that it starts to impact their lives in concrete ways.
Well, and headaches have also been like oddly normalized. Like they're not normal. You're not supposed to have headaches.
Your brain is talking to you.
Yes.
Yeah, exactly. And so I really, I mean, I have such a mission to make sure people understand this and they go get it fixed sooner rather than later, because it's so much easier to fix before those changes have happened in the brain. Once they do, it's still fixable, but it's harder. It is harder. You literally have to do things that rewire your brain back to that normal, healthy state. Whereas if you catch it a little bit earlier on, you don't have to. So I designed a quiz called the Headache Quiz that people can take so that they can figure out if they are starting to show signs of chronification. It's at headachequiz.com, super fast. It'll only take you a couple of minutes, and it will help you understand, get an objective read on where you're at and whether or not this is something that like needs to move up on your radar screen. You know, get your own labs checked and not just your car's oil change.
Yes, exactly. And you know, she's talking about this chronification thing, and we kind of talked about it at the beginning too, but I'm just going to reiterate it from like another perspective because I think it's so important to understand. So this ties back to like the wired and tired thing, or the fight or flight thing, Like if you are living in a state where you just tend to run on anxiety all the time, and that's just kind of how you run your life, which is kind of like the wired aspect, right? You can essentially like physical therapy your brain to the point where like that's just how you exist in your life because of exactly what she's talking about. It's like the chronification of certain pathways that get fired all the time. So if you, and this might be a little controversial, but I'm going to say it because I think it's important. If you victimize yourself and you allow yourself, because yeah, your thoughts are not in control, you're in control. If you allow yourself to be anxious and stressed out all the time, and you never have some kind of practice of stopping that, like meditation or mindfulness to retrain your brain, it's basically physical therapy for your brain. That's what mindfulness is. If you allow yourself to do that all the time, it will get worse over time. And that's exactly what she's talking about. So whatever pathways you're firing in your brain, those are going to become the stronger ones. And that's, you know, concepts that meditation experts like Dr. Joe Dispenza talk about, is like your personality is your personal reality. So you like the main work that you can do is just start shifting stuff on the inside. So when it comes to anxiety, because I think somebody, yeah, I was just asking questions about that. So like breath work. Breath work is free. You can do it at home. It's all over YouTube. You can just Google it. Starting to work with breath work and like taking a minute out of your day where you're so focused on your body that you lose track of everything else in your day. That's a really good way to start to kind of work with that. There's other breathing techniques. I actually go over a bunch of anxiety techniques and provide meditations in the course that I do. And if anyone's interested, if you want to learn more about that, you can just click on my name, go to the link in my bio, and it has all the info there. And you know, Dr. Amelia has her own online course that she does too. And she also teaches yoga and things like that. And like yoga, meditative movement, anything where you're not running the speed of society is usually a great way to work on anxiety. Like our society runs too fast for humans. I'm just going to say it. It does. Like we weren't really designed to run this fast, but it is what it is now. And so we just have to figure out ways of doing that. And that's why you see some of the most successful people in the world, people like Dr. Mark Hyman, being like, I don't have time to not meditate. Like I have to do this. I'm one of the busiest people in the world, but it's the only way my brain works, right? And I will agree with that. Like on days where I miss my meditation, like I'm totally still functional. I'm still myself. I'm probably a little bit more reactive. I'm definitely more anxious. And I'm not as smooth as on the days when I meditate. It's like a really good way to say it. And, you know, and I know like a lot of people dealt with stress and adrenaline, like just from dealing with the pandemic and stuff. And I'll provide you a little insight that I came to myself that I think is just useful for anybody. And I think this happened for a lot of people during the pandemic, is they lost sight of a safe place to put their trust, right? And it became awkward of like, well, I'm afraid to trust the world because so many unexpected things are happening. So I'm feeling a lot of anxiety around that and not being able to predict what's going to happen. And then I struggle with trust with other people because not everybody shares my values, and they're allowed to do that. Humans are allowed to have whatever values they want, but that stresses out and that causes anxiety. And then it became hard to almost trust yourself as much too, because you can't always trust yourself to make the right decisions, especially when there is a whole bunch of unpredictable things going on. Like that's just an impossible standard. Anyone will drive themselves into insanity with anxiety trying to be perfect and always make the right decision. So ultimately, the place that you can put your trust is in your own resiliency. So if you're having anxiety about everything that's going on in your life, focusing on how many times you've made it through that and how strong you have become from doing that, and on your body's own ability to heal, which is why Dr. Amelia and I love doing talks like this, is we love to remind people of their capacity to heal. So if you struggle with anxiety, like just reminding yourself of what an incredible being you are and what an incredible thing your body is, and just being empowered, knowing that there are things that you can do to take care of yourself at home, exactly like all the stuff we're talking about. And meditation's a great place to start for anxiety stuff. So Yeah, just Google someone like Dr. Joe Dispenza on YouTube. A bunch of his stuff will come up. Start watching that. It's a really good place to start. Or if you want a little bit more personalized help, reach out to Dr. Amelia or myself, and we'd be happy to help you with whatever you're working through.
Yeah, agreed. Yeah, and I love how you recommend Dr. Joe Dispenza as a place to start. I love his meditations. I do them regularly and totally second everything you say about how it impacts the day.
Yep, 100%. I think when people start to learn about meditation in a new way, and you start to understand it as this like creative space that you can go into and work on yourself within, rather than like one more task you have to do on your list, it becomes a place of sanctuary, and it becomes a place of slowing down and a place of taking a break from all the things that are making you anxious and stressed out, so that you can reprogram your neural wiring like we're talking about, so that you don't get the chronification of whatever you're dealing with, because that's ultimately like what disease is, right? It's long-term chronification of a dysregulated biochemical pathway of some kind.
Mm-hmm. Yeah, and you can monitor your body during meditation to see if you're having your desired effect. You know, there are a number of devices you can use to check and see, all right, did I actually put myself into healing mode in this last 30, 60 minutes or not? So you can use it as a physical retraining tool as well.
Absolutely. And I just saw someone ask, like, can we lead a class on how to meditate? That's a good idea. Maybe you and I should do that sometime. We can just like do a little live like this and guide people through one. That could be fun. And Dr. Amelia and I, we work with meditations all the time. So if you're curious, like we do have that as part of our coursework and stuff. But if you want free ones, like just go to YouTube. Just Google like meditation for anxiety on YouTube, and there's a ton. Or there's a really great app called Insight Timer. An Insight Timer is mostly free, and there's a bunch of wonderful people on there, and it's just an ocean of resources for learning how to meditate, because it's a practice. It's something that you learn over time, just like learning how to eat right over time, or learning how to drink more water over time, or all of these things. Like, it's all a maintenance of a system that we are facilitating, rather than like this destination that we're reaching. That is what health is.
Yeah, love it. Great vision for health.
Yes. Well, if people want to learn more about you or your classes or anything, or they want to work with you, where should they go?
You can go to my website, ameliascottbarrettmd.com.
Perfect. All right. And I think, and you guys can also just click on her name, and that will make sure you have all the correct spelling and everything. But yeah, I don't know. Any last thoughts for everybody?
You know, I think I just want to encourage everybody to take action and pay attention to yourself. If you're a female, put yourself first. That's hard to do. I know. I raised 3 kids. I know how demanding that is. But, you know, we all need to put ourselves on our radar screen in addition to all the other things in our lives that we pay attention to, our work, our partners, our friends. Like, we need to at least be on par with all of our other priorities. Ideally, taking care of yourself first. Nobody can steer your boat but you. But I know that sometimes that's too far to go. If you just think of it as, hey, I deserve as much attention as my kids are going to get from me today. You know, if they're getting 3 hours of your time, is it so unreasonable to think of spending 3 hours on your own self? I would say, no, that's not unreasonable. And yes, it's okay for you to have exercise classes throughout the week, not just, you know, having it be about taking your kids to their exercise classes. You know, you get to be in there too. So listen to yourself, tune in, and nurture yourself the way you nurture everybody else.
Yes, 100%. And I always see a couple things coming in towards the end. If anybody has specific questions about your own condition, we can't answer that here, but you'll have to message us and we'll see if we can help you out. So just send a message. And then other people asking, like, do things like spike mats help? I want to come back to what she was just saying about taking care of yourself, right? Spike mat is pretty much body work. Body work is a really easy way to start taking care of yourself if you're not good at it. So if you're not good at setting time aside for yourself to go do something nice for yourself, schedule yourself a massage or an appointment with your acupuncturist or an appointment with your chiropractor or an appointment with someone that does some kind of body work. And that's a very gentle way to start making time for yourself and start basically helping your body enter a meditative state with the assistance of somebody else. I think we really underestimate the power of body work. So there's bound to be some practitioner in your area, and you can search for that as a way of just starting to love yourself a little bit more. And if you guys, if you guys have any questions, her website was ameliabarrettmd.com, correct?
It's Amelia Scott Barrett, actually. So it's
Thank you.
AMeliascottbarrettmd.com.
AmeliaScottBarrettMD.com. And if you guys want to learn more about any of the stuff that I do, you can just click my name here and click the link in my bio, or my website is just depthwellness.com, like you have depth, because you do. So Dr. Barrett, thank you so much for taking the time to do this. I always love our chats, and we'll come up with some cool, fun meditation one for people in the future.
That sounds awesome. Yeah. Thanks for having me here. It was great.
Absolutely. Have a good day.
You too.